Now it is ascites, and they can give you in exam. It is also appearing commonly, and ascites again as a part of abdominal station, and the command can be: the patient presented with abdominal distension, kindly examine the patient. Patient has abdominal discomfort, kindly examine the patient. Or they can point out towards the cause of it, ascites. And then, there are different causes for ascites. You should know, if they ask, you should know the 5 common causes or 6 common causes, and then you have to see the features for those causes in your patient, and as well as it can be the command, like patient presented with breathing difficulty. So kindly examine the patient. If it is due to heart failure, and if it is due to cirrhosis, then again uh, the commands can be, as I explained yesterday, these could be the commands. And like this, if it is due to malignancy, patient presented with weakness. So in all case, you have to examine your abdominal station, and please do not omit any step. And again, your inspection should be very strong, keeping in mind all the possible causes for the ascites. And then you will examine your patient. Now, what you will see on inspection, like when you are standing on the foot end, you can see that abdomen is distended and umbilicus is everted. Okay, so, and you can see any prominence of veins, and rest all the features for inspection you have to see, like as I explained yesterday in the chronic liver disease. These all features keeping in mind you will see. And when, because ascites could be as a part of chronic liver disease, and it could be a part of other causes, like there are 6 causes which you should keep in your mind, like examiner, if examiner ask, then also you should tell at least these causes: cirrhosis, malignancy, heart failure, nephrotic syndrome, tuberculosis, pancreatitis. Okay, so when you are doing in your inspection and you saw distended abdomen, up till now you have not touched the patient. Okay, you are just inspecting at the foot end, initial 30 seconds of inspection. So you can, when you saw distended abdomen, you expected that it could be ascites. So you will immediately scrutinize the patient for cirrhosis, chronic liver disease signs on inspection, which could be appreciated. And you will look for any elevated venous pressure in case of heart failure, and pedal edema. Okay, so these features, you will inspect these, the high yield causes for the ascites I told you, which features you are going to find, like cirrhosis, heart failure, nephrotic syndrome, and malignancy. You can see the cachexia, you can find a cachectic patient, you can see the side of temples, they will be wasting, and otherwise also the patient will be wasted. You can appreciate there will be dorsal guttering of the hands, like this. So, like without touching the patient, when this is just on inspection, you are trying to guess what could be the cause for this abdominal distension. Okay, so now when you will examine, you will follow your scheme for the abdominal examination, and you will do all the steps. And if you find ascites in the abdomen, you will find abdomen is distended with everted umbilicus. And regarding ascites, you will say that there is clinical evidence of ascites as evidenced by shifting dullness. Okay, now there are 2 signs which usually candidates are doing: shifting dullness and fluid thrill. You don't need to do these 2 signs. Perform one, do one sign. Okay, do one maneuver. If you have done shifting dullness, then do not do fluid thrill, and if you have done fluid thrill, then do not do shifting dullness. Either one of it you should do. Okay, so like this. And then how you will present again, as we are presenting any case of chronic liver disease or of abdomen, as I explained. I will like to complete my examination by examining external genitalia, examining hernial orifices, doing rectal examination, and taking alcohol and viral history. On examination of this gentleman, I found that whatever signs now you found in the hands, in the face, in the chest, about any cause for the ascites, now this you will explain. Okay, and then you will come to the abdomen, and then you will say that abdomen is distended with everted umbilicus, and there is clinical evidence of ascites as evidenced by shifting dullness. And now they want you to know the cause for ascites, and now you can add on further. If you found any sign for chronic liver disease, you will explain. If you found that there is cachexia, and you inspected side of temples, they were sunken, triceps skin fold thickness it was less, and there was dorsal guttering of the muscles of hands, and patient also looks thin, patient is of old age, and also you felt lymph nodes, so then you can say that the cause could be malignancy. And like if you found pedal edema and raised venous pressure and facial puffiness and periorbital puffiness, then and tender hepatomegaly, tender abdomen, then you can say that the cause could be heart failure. And if you find pedal edema and all swollen face and periorbital puffiness, then also you can say the cause could be nephrotic syndrome. Okay, so like this you will add on whatever cause, whatever signs for the respected cause you found, you will explain and you will add on, because giving just a simple diagnosis of ascites, this is not enough. You should be able to appreciate the cause. You should be able to identify the cause, which is obvious most of the times. Okay, so now few things I want to tell you. If you found lymphadenopathy, then you can, I will tell you just simple, like if I don't want to teach you all the current, and like I want to tell you simple and high yield causes, like this you should know, and if examiner ask, then you can tell, and it is high yield as well as it is related to your Paces exam, and also this will be enough. Okay, like if you found lymphadenopathy with the ascites, you should think for malignancy and infection. Okay, and when there is ascites, like you found ascites, then the most common cause is cirrhosis, chronic liver disease. It should come into your mind. Other causes should also come, but first of all chronic liver disease should come, and you should see the patient with this view. And there are many causes for abdominal distension. Don't just think that this is ascites. Ascites can be confused with obesity, and you can differentiate it by doing shifting dullness or fluid thrill. Okay, and you can find everted umbilicus when ascites is thin, and like in the end, if you ask patient to cough, you can find some hernia as well. And if prominent abdominal veins, this I already explained, it could be due to caput medusae like portal hypertension or inferior vena cava obstruction. And then you should try to elicit it is due to which cause, like you will obstruct the vein and then you will see. Then and facial puffiness also you should try to appreciate, and any pedal edema because to any elevated venous pressure, like this you should be able, so that you can guess whether it is due to renal cause or cardiac cause. Okay, so common causes for ascites I told you, this you should know, and you should see in the patient. If at least these you looked into the patient and you did not find any relevant feature, then mostly you will be justified, that at least you saw the common causes, common features. Uh, like when examiner asks, okay, what is the cause, so you can tell if you find any positive features for cirrhosis, heart failure, malignancy, then you can tell you found any positive signs. If you did not find any signs related to these conditions, then confidently you can say that you did not find any signs relevant to these conditions. Okay, so examiner will know that you know at least how to, you know the common causes for ascites, and you saw for the signs for ascites. Okay, so and then you can give some other causes for ascites as well, and this is just for theoretical purpose. Just I will tell you: malnutrition, malabsorption, and butt carry, like this you can say. So how you will investigate? Investigation again will be like as I explained for the chronic liver disease. You will start from the blood counts, and you will tell in the cause for doing for each test, like complete blood count, looking for thrombocytopenia and anemia, and blood sugar, looking for hypoglycemia. Now these are all tests for chronic liver disease. For the blood test, this blood test you will tell, and you will tell ECG, echocardiography for the heart failure, and if you suspect malignancy, then you will add on further chest x-ray, chest CT, abdominal CT scan, like this. But the specific an abdominal ultrasound, and specific test you can add on. If there is ascites, then you can say that I will do diagnostic paracentesis as well, to look for ascitic fluid, albumin, total protein, differential WBC count, and ascitic fluid, gram stain and culture, and cytology. So is it okay? Is it clear? Like how you will explain the investigations? You will describe investigations of if there is ascites, chronic liver disease, malignancy, and heart failure, and nephrotic syndrome. At least these you should explain. Okay, and the same way, like you will start from non-invasive and go to invasive, and telling the cause for doing each blood test, as I explained yesterday in the chronic liver disease. Okay, like if you say coagulation profile, looking for INR, PTA, PTT, and like this serum albumin, and like this you will say. Now you should know this serum ascites albumin gradient, and if it is more than 11 gram per liter, it shows that transudative ascites, and if it is less than 11, then it shows exudative ascites. Okay, and how you will manage ascites? Then again, my management includes journal and specific, and journal same as we are doing patient education, counseling, explanation of the condition, and giving immunization, taking care for the diet, restricting salt and water intake, and treatment of the treatable causes. And my specific menu includes the medical and surgical if needed. The medical menu includes dietary sodium restriction, fluid restriction, and diuretic therapy with aldosterone antagonists like spironolactone. Okay, and so like this you will explain your management for ascites.
Please like, share and subscribe my YouTube channel for more videos. Thank you.